to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Brandon Lee, the co-founder at Power. Brandon, how are you today?
I'm doing well. Thanks for having me on today, Jared.
I'm excited to have you on. There was something I saw the announcements recently with you. And your company, and then your logo, your color scheme. It really drew me in to learn more
Oh,
about
great.
the company. I know, weird, right? Um, I just really love the color purple.
Sure, yeah.
It's so weird, but that was actually part of what drew me in. Was I liked the logo, I liked the name, clicked on it, saw the recent raise, learned about you a little bit, and I'm like, let's get Brandon on the podcast. And that's that's how the whole flow went.
That's funny, right? Um, I think that a lot of people uh, don't pay enough attention to the branding, like the external facing branding, when you're building a company from the early days. It's not the most important thing that you do, but you want it to evoke a certain emotion to the folks who interact with your company. And it sounds like it evoked an important reaction from you, Jared. So I'm glad to hear that.
So I would love to dive into this conversation today with you. Um, if you don't mind, I'd love to kick things off to hear a little bit more about the your background, and then we'll talk about Power.
Yeah, sure. So, my background, born and raised in Toronto, so Canadian by origin. I've been living in California in the Bay Area for the last 5 or so years. I'd say most of my professional experience has been in building and scaling marketplace businesses, specifically in historically traditional industries where accessibility has been a problem. So, one of the prior experiences before Power was building and scaling a home services marketplace, trying to help people get in touch with general contractors, plumbers, electricians, that kind of thing. Um, all of which is to say, I don't really come from a healthcare or clinical trial background, right? I come way more from the marketplace side. So the journey into clinical trials is far more personal. A handful of years ago, I had a close friend of mine diagnosed with a brain tumor, and luckily she's doing okay, largely because she was able to navigate the clinical trial system on her own and find her own way in. And being on that journey with her helped me realize that in a very weird way, finding a clinical trial felt similar to finding a general contractor. There was a bunch of information asymmetry. The experts on the other side were non responsive, and it was just a difficult space to navigate. As we realized that, hey, you know, we could do a whole lot more good here, taking some of the skills we had built building marketplaces in other spaces and building for patients in the clinical trial space.
And then enter Power, right? So your
Absolutely.
background, this experience brought it came together. Um, you already kind of gave us the why. Can you tell us like how Power works today, and just maybe give us the quick 1 to 2 line description for the audience as well?
Yeah, absolutely. So you can think of Power as the most patient centric platform for finding and navigating the clinical trial space. In essence, we make it very easy for patients to find and get access to leading medical research.
Thank you so much for that. And that was, you could tell he's fresh off pitching VCs too, right? That was just clear, concise. I like it. Um, the parts when I was going through the fundraising process, I actually loved when I went through talking with VCs,
Sure.
because like that is, from a sales perspective and a partnership perspective, the tightest your pitch will ever be is coming off those meetings. So
Yeah,
it's like you don't even have to think about it, right? It's that unconscious competence. You rattle off all these facts and statistics about your company. So that's really cool. Um,
totally. And I don't know if you found this, but um, it really helps you dial into what really matters. What's the key point you're trying to get across?
yeah, because VCs, they don't like the BS. They want you to get to the point quickly. They want you to be able to focus in on exactly what you're trying to build. So the whole exercise of going through those conversations, it always helped several months even after closing any
Sure.
type of funding. Um, but yeah, and we'll talk more about your recent funding round towards the end of this episode. But I want to make sure we kind of talk through some of the main points that I was really interested in when I was learning about your company. So
Sure.
I would love if you could talk through the importance. You mentioned it a little bit earlier with your friend, but the importance to helping patients find and get access to clinical trials. through your lens?
Yeah, totally. So at a fundamental level, we believe that all patients deserve to have access to leading medical research if it could help them. Not only those patients that currently have access to top doctors and hospitals. Unfortunately, today, something like less than 5% of physicians participate in clinical research. As a result, it's only those physicians and their patients who really are in the sphere of research. 95% of patients are kind of left to the wayside, left to their own devices to go looking for clinical trials as an option if it could help them. Um, Unfortunately, for folks where the standard of care, the standard treatments have failed, some of the stuff in clinical research can often provide the best hope. Um, and there is this transparency and accessibility problem that is just keeping those patients from understanding what their true options really look like.
Transparency is something we hear so often in healthcare as
Sure.
one of the major issues, and it's partly because of how like private the health information of patients is. Uh, but I guess in regards to the clinical trials, how do we? It's transparency is a fine line, right? How do we follow transparency but help people get access to better clinical trials? Like so, when I guess from a transparency perspective, what type of information are you asking like patients to share to get access to these clinical trials?
We actually think of transparency from the other side. Um, we're not so much concerned about capturing all the information about the patients and making them transparent to the trials. What we're concerned about is capturing all the information about the trials and making that transparent to the patients. And that kind of goes back to our original ethos of putting patients at the center of this platform we've built and making their lives and their journeys easier in a time when, frankly, there's a lot going on for them.
Yeah, thank you for adding that. That's a really interesting approach, and I think that's part of the reason the space is where it's at today. Before what you're building, is because it was flipped.
Yeah, that's right.
So you taking that transparency approach is very welcoming to hear.
Yeah, and it'd probably be inappropriate for me to like not mention that there are lots of people who care deeply about patients and who are working actively to put patients at the center. For example, there are incredible patient advocacy foundations, patient navigators who specifically work one-on-one with each of these patients. But what we found is that we thought that there was an interesting opportunity here to apply a layer of technology that could provide transparency in a scalable way, whereas previously it relied on heavily manual labor and individuals working with each other to try to navigate the system.
Very interesting. Yeah, it'll be cool to see how you continue to build this out.
Sure.
Um, and congratulations, obviously, on all the success so far. But I mean, you're just getting rolling. This is going to be an exciting journey to see what you put together here.
Yeah. In kind of like the proverbial Jeff Bezos terms, this is just like day one.
Yeah, absolutely. But it'll be really exciting to see what you build here.
Appreciate that.
Can we talk a little bit, Brandon, about the recent funding round? I guess, how much was raised, who participated?
Yeah, absolutely. So we raised $7 million, um, and we feel really blessed to be working with some of the sharpest minds across healthcare and consumer technology, which is really where our platform really sits. So on the healthcare side, we're working with CRV, Kristen, who it sounds like you know and you've spoken with before, as well as Artist Ventures that leans heavily into the tech bio side of the world. On the consumer tech side, we're working with Footwork, Nikhil Vasutravetti, who runs an awesome Substack. I'll plug it right here, as well as Mike Smith, his partner at Footwork. And then we're just surrounded with who we think of as some absolute legends in the space. On the pharma side, right, Jeff Kindler, former CEO of Pfizer, and then on the marketplace side, working with some icons like Lenny, Casey Winters, Ethan Smith, and a lot of others who have come together to really lend us their support and expertise.
Yeah, it's quite the crew you have attached to the company. That's a
It,
good group of investors.
it's amazing, I think, when you apply technology in an interesting way and really go after a meaningful mission, you can generate a ton of excitement, which we're the lucky beneficiaries of.
Absolutely. Well, so you raised this funding recently. You're building. What's
Yeah.
next? What are you excited about?
Yeah, absolutely. So, I think of this in kind of three terms. So the first one is on the patient side, we've been growing steadily. Actually, I should say growing rather quickly on the patient side. It's just had an incredible uptake. When patients see the experience that they can have on Power versus the status quo of clinicaltrials.gov, it's been pretty obvious to them how it's a differentiated experience. So continuing to lean into that original ethos of building for patients. Number two is we're starting to work with the life science industry to show them how a patient-centric platform like ours could have a ton of impact on their R&D life cycle. So we've got an excited waitlist of life science partners that have started reaching out to us to become participants on our platform, and we're excited to continue working with them, work through the waitlist, and get everybody on board and experiencing the power, pardon the pun, of our platform. And then the last piece is continuing to grow the team. So, as you can appreciate at an early stage, the team is everything, right? The team is the product. The team is the company you build. So, looking for our next great team member to come join.
Love it. We need to make you a Spotify playlist of every song that has the word power in it.
Yeah, it'll just be on repeat, in
Yeah,
our
just on
digital
repeat
office.
until people get annoyed. I love it. Well, Brandon, I want to have you come back on again. We already talked about it when we were chatting earlier. Put together a panel. We'll talk more about the importance of what you're putting together and just the industry in general. But really appreciate you coming on the podcast today to share your background, some thoughts on the company and your recent fundraising round. And wish you all the best of luck.
Awesome. Thanks so much for having me again, Jared. This was a ton of fun.